Okay, looking at this form, this is the oral conscious sedation form that we use in our office. It is broken into 3 sections. The top section is the information gathered before the sedation appointment. The middle section shows the protocols that we follow based upon the information gathered before the appointment. And then the bottom section helps us keep track of the sedation medications as well as the anesthetic and nitrous that we use during the course of the appointment. When this form is completely filled out, it is put into the patient's chart and as part of their record. The next step in this video is we're going to go through each one of these sections in detail. Okay, so now that we've seen the form in its entirety, let's zoom in on that top third and take a look at the initial information that would be taken down by a staff person. And this would be done usually outside of the clinic room, in our consult room, when the patient's in to just put together the treatment plan and move forward with the overall treatment. So, pretty easy stuff. Fill out the patient's name. We'll say their name is John Smith. Allergies, we'll assume they have none. No need for any pre-medication and antibiotic pre-medication. Let's circle no. The daily meds, instead of writing in all of the medications, we take the prescriptions that the patient has and put them into a program called Lexicomp, and we also put in all of the different drugs that we're going to use and then see if there's any cross reactions. So attached to this form will be the Lexicomp report. So that's just a reminder to our staff to put that in there. Let's also assume that our patient here, John Smith, is not a smoker and that they don't have a delicate stomach or that they are a gagger. Okay. That information would play into the doctor's decision on what medication they're going to give in the protocols. Let's go ahead and say that the baseline date is 2/10/13, and let's make John Smith 55 years old and give him a weight of 195 pounds. On the ASA classification, it's 1 through 4. The doctor would make this determination, but let's just for sake of example, let's just say he's a 2. And the baseline information we're going to get right here is taken from the pulse ox machine. And let's assume that his pulse was at 78, his oxygen saturation level was at 98, and his blood pressure was 134/83. Okay. Again, we like to take this information not in the clinic or back in the operatory, take it in the consult room when it's a less threatening environment. For some patients will say the only reason the blood pressure is high is because they're sitting in the dental chair. So if we can grab this information when they're not in a dental chair, we can determine if they truly have hypertension or if it's situational hypertension, meaning when they're in a dental office as they claim. So yeah, this information right here would be gathered before we actually do the sedation appointment. All right, so the day of the sedation appointment comes and we're going to move on to this section, section 2. Actually, I should back up. The night before, the patient is going to take one of these 2 drugs, either diazepam or lorazepam. More times than not, it's going to be the 5 milligrams of diazepam. But then this is for the doctor to determine, and that's why this worksheet is given to the doctor after this first part is filled out, so that we can determine what medications we're going to need before the appointment and during the appointment. Okay, so the patient's going to be dispensed 5 milligrams to take the night before the appointment. So they come in the day of treatment, and we have their initial dose. Then after the initial dose, we're going to come back and do an assessment at 1 hour and then every half hour. Let's say we determine that the initial dose when they arrive is either going to be Triazolam or lorazepam. If you notice, these are the same across. There's just protocols 1 through 4. That plays into what we're going to do over in the reassessment or the initial assessment after the 1 hour of dosing. And we've got the different protocols here, 1, 2, 3, and 4. Most of the time, we're going to go with protocol number 2. Because I know that more times than not, I'm going to give the Triazolam mixed with the Hydroxyzine. So let's say Triazolam, I'd say 95% of the time, we're going to give this amount. The only reason we'd give a little bit less is if the patient was elderly or was lightweight, basically, that they could probably get by with a less amount of the drug. The only real time we'd do lorazepam is if during the Lexicomp printout, if we noticed that there was a problem with Triazolam, then we'd move to the lorazepam. Okay. So this is given to the patient. Some doctors like to crush it and put it up underneath the tongue. Others just like to swallow the pill whole. I've tried it both ways, and I think just swallowing the pill whole is just easier. I don't really see much of a change in onset of doing it crushed. So let's assume now an hour has gone by. The patient says they feel a little something, but they're not really quite sedated yet. Now we're going to move on to giving them additional medications. So again, we are doing protocol number 2, and we're going to give them, depending upon how they're feeling, either 0, which means they're already feeling pretty good and we're going to move forward, or we can give them half of the original dose, which would be 0.125, or give them another 0.25, or in some cases we can go up to as high as 0.5, although this is very rare, and I actually cannot remember a time I've given a patient 0.5. Most of the time it's going to be 0.25. And as a side note, we always say 0.25. We don't just say 0.25. And when we write it down, we're going to write down 0.25. The reason being, I'll just use this worksheet here as an example. You could say 0.25, or you could say 2.5. The difference between the two is the 0 is missing, but this is the only thing right there, that little tiny dot. If for some reason that dot doesn't show up or somebody misreads it, they may take that to read 25 milligrams instead of 0.25 milligrams. So always put the 0 in front of the point. It just makes it clearer and decreases the chance for misinterpretation. All right, hydroxyzine, again, either 0 or we can go up to 100 milligrams. And how we determine the amount of milligrams is it comes in either pill form, which that's pretty easy to dispense. It comes in 10 milligram pills, or liquid form, which is what we prefer to give. It seems to have a faster onset. And that hydroxyzine is put together in a solution that is 10 milligrams per 5 milliliters. So we have to measure out how many milliliters we want in order to achieve the number of milligrams. Let's just assume for John here, we want a target dose of 70 milligrams, somewhere between 0 and 100. Usually we kind of err towards 50 or higher, but let's just say 70 in this case. So 10 milligrams, 70 milligrams. In order to get to 70, we take 10 times 7. In order to get from 5 milliliters, how many milliliters do we need? Going back to high school algebra, 7 times 5, 35. So we're going to dispense 35 milliliters of the hydroxyzine liquid to get him to 70 milligrams of the actual drug. Okay. So now we figured out how much we're going to give and how we've been dispensing this in the decision process along the way. Let's move down to the bottom third, which now is the recording section. And this information would actually be filled out before we begin the whole sedation appointment, so we can figure out what is going to be our maximum dosage. So for this individual, we decided we're going to go with the Triazolam, and that has a QF. That's a quotient factor put together by the DOCS organization. That's DOCS, the Dental Organization for Conscious Sedation. And they come up with this formula that you can figure out the top dose, or the maximum amount of milligrams you're going to give a patient of a drug at a sedation visit. So in this case, we're going to take we're going to take his weight, which is 195, and we're going to divide by 100, and that gives us 1.95. That is the maximum amount of Triazolam we're going to be giving this individual for this appointment because of his weight. If you notice up here, there is a guideline that the person has a maximum, or the maximum number you can put in over here is 200. If the person weighed, say, 220 pounds, if you did 220 divided by 100, you get 2.2. But the absolute maximum that you can give a Triazolam is 2 milligrams. So that's it's a maximum limit. It doesn't matter how big somebody is. 2 milligrams for the entire sedation visit is the maximum that we can give. Additionally, we look at their age. If they're older than 65, we're going to take this amount right here and divide it in 2. So those are the 2 things we're going to look at. Look at their weight and look at their age. Okay. So let's say we're going to fill this out during the course of the appointment. Medication that they were given, we're not going to include the diazepam they took the night before, but we will take what they took when they came into our office, and that is the Triazolam. So let's go ahead and put that down. Triazolam, and let's just say they took that at 8:05, and we gave them 0.25, again 0.25, and that's a total of 0.25. Okay, an hour goes by, and they're not really feeling the effects, and so we're going to give them some more medication. At this point, we're going to, again, we're working with that second protocol, so we're going to go again with a Triazolam, and let's just say at that point it's about 9:08 when we decided to dispense that medication. Again, it was 0.25. Now we have a cumulative of 0.50. Okay, we'll come back to that in a second. And then we also gave them hydroxyzine at like 9:09, we'll say. And again, we figured out we wanted 35 milliliters of that. I'm sorry, 70 milligrams. That was 35 milliliters. So that's 70 milligrams of hydroxyzine. Since that's just a one-time dose, we're not going to maintain a cumulative running tally of hydroxyzine because that's just given one time, and that was right here, 70. All right, this cumulative amount is important when we're always going to be referring back to the top dose, 1.95. So we can tell at this point, at 0.5, we are well within the safety range of our maximum of 1.95. Let's just assume more time goes by and John here is not feeling the effects of the sedation yet. So we give him another Triazolam. And let's just say at this point it is 10:12. We give him that. We give him another 0.25. So now we're up to 0.75. And we can double check to make sure, would that be correct? Yes, we're still, of course, way underneath the safety limit of 1.95. And we would hope that within half an hour or so of this last dosage, which we find most of the time, John would start to feel pretty sedated and we could begin our actual procedure. Over here we're going to make note of the anesthetic that we use. And let's just say about 10:40 he was feeling good, so we decided to go ahead and get him numb. We used 2% lidocaine, and let's just say we gave him 2 carpules. Assume the appointment goes on and some of those teeth start waking up and he can begin to feel it. And let's just say at about 11:45 he starts to feel something waking up. So we give him another 2% lido, give him 1 carp, and then let's just say for some crazy reason we end up having to give him Marcaine at the end, and so we just give him 1 of those. And so that's how we can keep a total of how much anesthetic we've given during the course of this appointment. And at the very bottom we've got the nitrous usage. Let's say we started him on nitrous at about, let's just say 10:35. We had a nitrous level of 20%. And we ran it all the way until about 12:15. And then we would add that up and come up with our total time, 1 minute and 40 seconds. So that's how we fill out this form for our oral conscious sedation. This form is downloadable on our website, ctduniversity.com. That's Cross Timbers Dental University. Feel free to use this form, and I hope it makes your sedation cases much easier to manage. All right, thanks.